Aortic stenosis is a condition where the aortic valve narrows over time. It's a condition that has a prevalence of about 5% above the age of 65. And so as you can imagine, with most heart diseases, the prevalence goes up with age. Below the age of 65 tends to be quite uncommon, except with the exception of patients who are born with some sort of abnormality within the heart valve. Patients who are at risk for aortic stenosis are patients who have classic heart disease risk factors, that is to say high blood pressure, diabetes, tobacco use, either active or remote, but a significant tobacco history. Those are the classic risk factors. It tends not to necessarily be familial or have a genetic predisposition. With aortic stenosis, the classic three symptoms are chest pain, shortness of breath, and dizziness and/or passing out episodes, particularly with exertion. So the questions that we always ask patients when we're asking them specifically about aortic stenosis is, when you walk or climb stairs, are you having a lot of shortness of breath? Are you having chest tightness? Are you having dizziness, or actually have you passed out? Any of those symptoms are a major concern regarding aortic stenosis. With aortic stenosis, people often wonder, well, how important is it? It turns out studies have, over the last 2 to 3 decades, have shown that aortic stenosis is actually even more serious than many cancers. So when someone starts to exhibit symptoms from it, their risk of mortality over the next 1 to 3 to 5 years significantly goes up. And so it's something that we definitely do not ignore. So traditionally, the treatment for aortic stenosis has been open heart surgery, where the surgeon opens the chest of the patient and literally replaces the valve, removes the old valve and puts in a brand new valve. We still do that today. However, in the last 10 years or longer, new therapies have come out that are catheter-based procedures, which are really neat, and patients love them because the recovery time is markedly reduced. Traditionally, with open heart surgery and open heart aortic valve replacement surgery, the typical hospital stay is about 5 to 7 days. With catheter-based replacements, they go home typically the next morning. There are two therapies for aortic valve replacement. One is surgical, what we call SAVR or SAVR, surgical aortic valve replacement, which is traditional open heart surgery. That's where the patient has their chest opened and the valve literally removed and replaced with a brand new valve, and that is done by a heart surgeon. Now we have done much more commonly transcatheter valve replacements, otherwise known as TAVR, T-A-V-R, where the aortic valve is replaced by means of a catheter, typically through the groin, but we can use alternate accesses as well, depending on what the patient's anatomy looks like. TAVR is a really neat therapy that has gotten really more common since about 2015 and 2017, mostly because of the recovery time. So typically patients require about 5 to 7 days with surgery, but with the TAVR, they often most commonly go home within 24 hours.